Hello, welcome to my YouTube channel. I'm Dr. Hassan. So today I'm going to discuss another important topic for you guys, which is Crest Form. This is the form which you have to upload on OEL website just to get eligible for your MSRA exam, which is a specialty training exam in the UK. So a lot of candidates find it difficult how to fill the Crest form correctly. So today I'm discuss the correct how to get it correct form of Crest form and how to fill it. So make sure that you should watch the video till end to get a better understanding of Crest form and how to fill it. So, apart from this, the Crest form, what you need, I will also discuss later on. So let's start. So the last updated of Crest form was in 2023, and it is used in 2024. So it is also valid for 2025 first round. So when you get the Crest form downloaded from NHS website, then you can get 4 to 5 pages. So on the first page, you find that there are some instruction for the applicants. You can see on the screen that there are 10 to 12 points for the general instructions. So the instruction says that the Crest form should be signed by a consultant, which means that the consultant should be on the registry, consultant registry on their respective countries' governing bodies. For example, if you're applying from Pakistan, then the consultant should be on specialist registry in PMDC. So who are eligible to get signed, the consultant can be general practitioner, clinical directors, medical superintendent, etc. So the second point says that it should be 3 months that you have worked with that specific consultants who are you getting signed your Crest form. And apart from this, it should be within 3.5 years. Like if you work with him in 2019, then you are not eligible, and the consultant cannot get signed, and the Crest form will be rejected if you sign from that consultant. The third point is just like it should be in English. It's not important. Number 4 says that the consultant should not be close relatives or friend of you. The fifth point says that you should meet all the professional capabilities. If you don't demonstrate the professional capabilities, then you are not eligible for specialty training as T1 and as CT1. So if the another point says that if you are already working in the UK as FY2 or completed FY2 in the UK, then you don't need to fill this form. 7th point says that each and everything should be filled correctly. If you skip or if you missed any box, then the form may be rejected. The 8th point says that if it is digitally signed, then an email from the signatory work email address you should be give to them their email and for purpose of for purpose of confirmation. So if you need another other information, you can also visit on OEL NHS website. The 10th point says that after correctly filled manually or digitally, it doesn't matter that you fill it digitally or manually. So you should scan and upload and attach in single document. You should not upload in different pages. It should be in one document. Along from the Crest form, what you need is that your consultant's license or certificate copy, and another document you need is that consultant should be write on his letterhead or hospital letterhead that this doctor is work under me and I have given him my license as a copy of my license as evidence. So these 3 documents should be in one document, and then you have to upload on the OEL website before submitting your application form on ORIEL without uploading the Crest form. If you submit your ORIEL application, then you cannot edit it and you are not eligible for MSRA exam. So be careful in mind that you should upload the Crest form, corrected form of Crest form, and then submit your ORIEL application form. So this is the only 2024 version of the form will be accepted. So on the 12th point and last point, they say that if you already given MSR exam and if your Crest form, which meet the eligibility, that is, it is come under 3.5 years from the date of advertise of the post, then you can use the previous one. Okay, understand? So comes to the first page of the application form. You can see that on the top of the form is just applicant name, applicant GMC number. I have mentioned that it must be completed by the applicants. So the details of your employer name, your hospital name, your role. For example, if you're doing medical officer, your hospital name, date, start, and chronologically, and your latest one should be on the top. Okay, and then at the end you should get you should sign the this you should sign in this box. So come to the second part. These are the capabilities: clinical assessment, clinical prioritization, holistic planning, communication care. All the things you should have. This should be this should be filled by your consultant. And on the right side, you can see that there are three colors: pink, yellow, and green. All of the green boxes should be ticked just to get accepted form of the Crest form. If you tick the pink one, then you are not eligible for MSRA exam. Then your consultant should sign over here, and there's no need of stamp on this box, your name and the date. For example, if you completed this Crest form today, so you can mention today's date. The second page also similar, and also further capabilities and other parts. For example, you can see that sharing vision, work confidently with the multi-professional team, and where appropriate, guide the team to deliver consistently high standard of patient care based on sound ethical principles. So if the consultant is witness, then you will tick the green. If some evidence is received by someone else, then yellow, and the pink one, you are not capable of this. So again, all of the green boxes should be ticked for eligibility to sit in MSRA exams. So all of the green boxes should be ticked. You don't need, if you skip the single one, then your Crest form will be rejected. Then again, the signature of the consultant, your name, and date of completion. So come to the next page, that your name, your professional status, your current post, all of these boxes should be filled correctly. Your email address, your GMC number, then comes to your governing or registering body, PMDC or whatever is. So this is for those who are not registered with UK GMC, okay, and your registration number. So, and come to the next part. All of the four boxes should be ticked. Don't skip anyone from these boxes. So then your signature of your consultant, your name, and your date of completion you can mention over here. Okay, so this is the most important thing that a lot of candidates are find difficult and confusing part, that whether hospital stamp should be or the consultant stamp is like enough to get stamped. So if your consultant stamp consists the hospital name, then it is, for example, Dr. ABC, consultant pediatrician, hospital name, it will be valid. If just Dr. ABC consultant pediatric, just and don't have any hospital name, then you need hospital stem. Or you can just, uh, if you have easily access your hospital stem, then just hospital stem is more than enough. Okay, and the last page of the form, which most of the candidate do not need to get filled. So it's actually the someone is you have worked with someone else, and your Crest form is signed by someone else consultant. So it should be avoided in this circumstance. It may a little bit complicated for you guys. So um, so most of the candidates skip it. And if you have get uh, signed from the consultant which you have worked, so you don't need to get filled this form. You can just skip this form. So this is all about Crest form. So if you have any doubt, you can email or you can write on comment. Please um, share and subscribe my channel for further videos. I will also upload an Oriel application form to make more clear these points. So three things you keep in mind: that correct and each and everything you should be filled on Crest form. And the second thing is that what you have to need to upload on the your consultant license or certificate, and on his letter pad he must mention that he has given you as evidence uh, uh, as his license or certificate. So uh, all these three documents should be in one PDF form, and then you have to get upload on the Oriel website. So guys, thank you so much for watching my videos, and hopefully it will get benefit for you guys. Thank you so much. See you soon.